Greater Indiana Chapter. Before we turn things over to our host to kick off this morning's meeting, I just wanted to share a few housekeeping details. First, we want to thank you for being with us virtually. This idea originally started as an in-person event a few years ago, and we look forward to the day when we can return to having breakfast together. But until then, this has been a great platform for us to connect. Today's meeting is being recorded for those who are unable to join us and would like to participate. And we are going to be cognizant of time today. We really want to respect everyone's time and end the meeting on time, if not early. And so we encourage you to use the chat feature for questions and comments during today's presentation. We likely won't be able to address questions and comments during the meeting due to time, but the team at the Alzheimer's Association will take note of all those questions and comments, and we will get back to you after the meeting. We will be using the polling feature here in a minute, so stay tuned on your screen to get connected with that. And today your line is going to be muted to reduce any background noise, but if you do need to speak, feel free to unmute yourself. And this is the third year that we've hosted this gathering for Indianapolis community leaders. I want to note and thank our previous hosts of the event, Dave Ricks and Mike Harrington from Eli Lilly and Company, Mark Miles from Penske Entertainment Corp., Tony George, and Indianapolis Mayor Joe Hogsett. The event has been really well received, and through this platform, we've been able to meet and form relationships with a lot of Indianapolis community leaders who care about the Alzheimer's Association mission. So we're going to start today's meeting with a quick poll just to gauge our audience and your connections with the mission. If you can just take one quick moment to answer the polling question on your screen, we will share those results. All right. Well, you can see that a large majority of our, hopefully you can see, a large majority of our audience has a personal connection, either caring for someone with Alzheimer's or another dementia, or personally having lost someone to Alzheimer's or another dementia. But I also want to note that we have several business leaders on today's call who don't have a personal connection to the mission. And I hope that today you'll also learn about the impact that Alzheimer's and dementia have on all of us and our businesses and our community. With that, last year at this gathering, we were introduced to our host today, and I want to thank him for taking the time and energy and focus on supporting this mission and bringing all of you together. And I'll turn it over to Ursal Ozdemir.
Good morning. Thank you again for taking time to join. And we convene today as Indianapolis business leaders to openly consider the very impact of Alzheimer's disease has on our families, businesses, employees, communities, and outline ways we can confront the challenges of Alzheimer's that presents. As active participants of our local civic and corporate community, Keystone and Ind11 are regularly approached to support many fine philanthropic efforts in Indianapolis. As Natalie mentioned, Mark Miles joined the similar event last year that Mark was hosting. His parents had Alzheimer's, and he shared his personal experience, and he asked me this year to host this event, and I'm happy to do so today. Like many of you, everybody is aware of Alzheimer's disease. One thing that I'm not sure everybody knew was my father was diagnosed over 10 years ago with Alzheimer's in Turkey. He's 87 years old and had a very healthy life and very healthy person until he was diagnosed with Alzheimer's over 10 years ago. Him and my mom are amazing people and have provided us unconditional love, guidance, and all the values that we try to be a good person. My dad was also in construction real estate, and every time he visited here, he was proud to see some of our projects, and some of the pictures that I shared was in front of one of our projects in downtown Carmel. About 10 years ago, I was aware that he was getting worse. I was told that he has Alzheimer's. Didn't really hit me about 10 years ago when we had our first child. They visited 3 months after my daughter was born. He was sitting across the couch, and he basically suddenly asked, whose baby that was. And that's the really first time that really hit me that this is really going to continue to get worse and worse. And it was a very odd and scary feeling at that moment. And my dad was always a proud person, and he's one of those that was very strong and never asked for help in his life from people. About a week later, just out of blue, we were sitting and said, son, I need you to help me. I need you to save me. This is in Turkish. And for someone that's never asked for help, especially from in his life, for him to ask help, and not only that, really, save me in a desperate way, it was very hard to take. We knew he had Alzheimer's, and there was really no fix at that time. But because really, when your dad says that, please save me, I reached out to the Lilly president then, as I knew they were working on Alzheimer's drug. And he was helpful to set up a meeting. IU Health has one of the best physicians, and they work with IU Medicine, School of Medicine, as well as IU Health. They were able to arrange a visit to IU Health. And obviously, after a couple hours of visit, they did tell us that he has Alzheimer's, and the pills that he was supposed to take, he wasn't taking them. Same pills that he would have been offered here, but it was making him not sleep well and stay awake all the time. And I literally took him to Eli Lilly, and I told my dad that, Dad, this is the drug company is going to find the Alzheimer's disease. I need you to take your pills. If you don't take him, literally, first time I had to tell my dad, you're going to die. And I need you to take this pill so that it gives opportunity for this drug company to find the cure for it one day. And he went back, and I was told that he started taking his pill because he was telling people that I took him to a doctor and a drug company, and that drug company was going to find the cure for him. So even though I knew the answer, trying to do anything to do something was really from desperation. It was an awful feeling not to be able to help your loved ones in these times. Another really odd experience, and 2.5 years ago, I got a call on Monday morning from my oldest brother that my dad was hospitalized and with a brain aneurysm, and the surgeon had to do a surgery ASAP, but because of his age and Alzheimer's, they were told that he would not make it through the surgery. So they asked me they were going to wait for the surgery for me to get out there to see him one last time before they think that he won't make it through. So luckily, I got on a flight in the afternoon. After 3 flights and about 24 hours later, by the time I got there, he was still alive, and we waited a few more days, and we realized that he's actually okay. And the surgeon said that if he don't have the surgery, he's not going to make it. We decided that if he's not going to make it anyway, why have the surgery? Let us enjoy his time, and without going to surgery. He's a stubborn man. 5 days after that, he got out of the hospital, and it's now 2.5 years since then. He's still alive, and it made that. But we realized that, unfortunately, what caused the aneurysm was the Alzheimer's, the brain shrinkage. At the same time, because brain shrinks, we're told, it gave a lot of space in the brain, and that allowed the blood clot to be able to stay there without really actually killing him. So it's a very interesting to able to be sick from the same disease and also save you at the same time for time being. There are no obviously good diseases out there. They're all terrible, but I believe Alzheimer's is one of the cruelest out there personally. My dad at this point doesn't recognize us. He's on bed rest 24 hours a day as he broke his hip and he's not able to walk. He is comfortable, but he does have no quality of life at this point. So, and he does not recognize any of the family members. My parents were awesome when I moved here 28 years ago. They visited every chance they can, from my graduation to major events and our children's birth. And we try to visit them once a year now. We weren't able to go this past year with the family, but we hope to do that this summer, hopefully, as the coronavirus becomes less prevalent around the world. It's incredible difficult to know what to do for him or how to support family members who are going through the same disease, especially from far away. My mom is an amazing person, still insists to have my dad at home, care him at home as main caregiver with my oldest brother, who is a physician, happens to live in the same town. Beyond my personal family, in Keystone and in the 11 family, we also have team members that are grappling with effects of Alzheimer's disease. We have a number of employees who have personal connections to the disease as well. My engagement with Alzheimer's Association allows me to connect our team members and employees best in class, no-cost programs and services. It's likely that you too have someone in your family or some of your clients and employees have similar circumstances. Facts and figures surrounding the disease tell us that there are thousands of families in our community who need support and services, but don't know the Alzheimer's Association as well. Last year, due to COVID, my wife, Isabella, and our 4 children, young children, our employees could not join the Alzheimer's Walk due to COVID, but we all did walk around our neighborhood and taking photos to share with friends and family to continue increase awareness. We want to help change this in our community. Right now, there are about 6 million Americans who are living with Alzheimer's, over 11 million Americans who are taking care of them at this point. In Indiana, in our own state, there's about 110,000 Hoosiers with this disease and about 215,000 unpaid caregivers. When we support Alzheimer's Association, the funds raised and contributed benefit our local community. The Greater Indiana chapter provides care and support to approximately 6,000 unduplicated individuals each year through education programs and support groups for caregivers, a 24/7 helpline, and a personalized support. The association's public policy efforts aim to increase federal research funding. Many of those dollars are invested back in our community through the research efforts for our local institutions. That was one of the first questions I asked to Natalie in group. I said, you know, there are a lot of diseases out there. We've been involved with several. And it's also, we're local. And it's important that some of these dollars are spent with our great institutions like IU Medicine, IU Health, and other great researchers. And they said that Alzheimer's Association currently funding 9 active awards, totaling $2.5 million to Indiana researchers at this time. One other fact that I did not know, Indiana Alzheimer's Disease Center, which has been around since 1991, is one of the only 32 centers dedicated solely in US to Alzheimer's research. The reality can seem overwhelming, and indeed it is for those living with Alzheimer's and caregivers. The hidden business costs are overwhelming as well. For all these reasons, as business leaders, we should feel the urgency to invest in research, provide employee support to assist, and retain our colleagues upon the conversation to include other local corporate leaders. Disease has impacted me and my family in so many ways, so if I can help any way, I will. Also want to connect the Alzheimer's Association with as many people as I can. Indianapolis is my home. My wife and I are raising our children here and want to help make a positive difference in our community by raising awareness to this important cause. I'm honored to introduce our next speaker, who's also making a positive difference in our community. Please join me welcoming Andrea Haslin Smiley. Thanks for being with us today. I'm going to turn it over to you. Thank you.
Thank you, Ursula. That was an incredible story and talk, and just heartfelt, and I so appreciate you sharing that. And you're going to hear I have a similar situation with my own dad. So thank you all also for joining and taking the time out this morning to hear more about the Alzheimer's Association. As Ursula mentioned, I have deep roots with the Alzheimer's Association. I currently serve on the Greater Indiana chapter as a board member, have for about 10 years. I'm a donor, sponsor, a company as a sponsor, walk team captain, chocolate Sunday table host, and actually also I'm going to be hosting the Longest Day event, which will be a euchre tournament that you all are invited to later this summer. It will be hosted at my house. So if I can get involved in the Alzheimer's Association, I try to. Like Ursula, I came to this work based on a very personal experience with Alzheimer's disease, and specifically with my dad as well. I know everyone believes, and Ursula has a phenomenal dad. I always grew up believing, and I think still do, that I had like the greatest dad of all time, and the coolest dad as well. He was the smartest, most well-read, insightful person I knew. He went to Berkeley, he went to Harvard. He had more graduate degrees than really anyone probably ever needs. He was a social psychologist and professor at Purdue. And he just was so passionate about learning, and he always had a book in his hand. And instead of having artwork up in our dining room, we had a huge map, and whatever was going on in the world and the news, we would have, the kids, we would have to go find the spot, and then he would talk about it, and we'd have to repeat it back to him. And it sounds kind of crazy, but it was so much fun. And he just brought fun to everything that we did. He went to Woodstock, and he would often talk about his experience at Woodstock, much to my mother's chagrin. He taught me how to drive a stick shift when I was in 3rd grade, and I'm not kidding. It's not recommended, but he just was, full of life. That's how we always thought of him, until we started to see the early signs of Alzheimer's. And that was when he was 63. So, and I'm 53, so 10 years from where I am now. But he was incredibly clever, and he could pull off the absent-minded professor brilliantly. But soon enough, we could tell as it was advancing quite quickly, because he had early onset, and there was no way of hiding it. Within 5 years, my dad had written so many different books, and he wasn't even able to read anymore, and he didn't recognize any of our family. Actually, most all of the family he didn't recognize. I still believe that I was his favorite because he did recognize me. And that goes over well with my brothers and sisters, as you can imagine. But even though he had been so physically healthy, except for Alzheimer's, incredible health, he passed away at 71 from Alzheimer's related complications. Basically, he just didn't remember how to eat anymore. That's basically what happened. And it was not only devastating just to see him go through all of this, but we were clueless on how to support him, let alone how to support ourselves and how to support each other, how to support my mom. And it wasn't until we were introduced to the Alzheimer's Association that we started to, understand what we could do. And my only wish is that we knew about the Alzheimer's Association earlier. It would have made a huge difference on how we were able to manage all of the logistical, the medical, and I think most importantly, sort of the emotional burdens that go along with caregiving. And the need to support families and caregivers resonates to me, not only because I felt it personally, but it's also part of the work that I do. And so I feel it professionally. So at VMS Biomarketing, the company that I work for, we work with caregivers and patients and families across all kinds of chronic diseases every day. And the toll is immense. It never lets up. We do these feedback sessions with patients, but also then with the caregivers, and they'll just talk about this burden that is on them, and that they're always looking for some kind of support or empathy or understanding. And this toll is even more immense when caregiving for Alzheimer's and other dementias. When family members are done with daily caregiving, they go to work where likely nobody knows the extent of their stresses and demands. They could be your employees, they could be your clients, they could be your partners. In fact, I guarantee it that they are. And I also guarantee that, like me, they need resources and guidance and support, which is what the Alzheimer's Association is uniquely situated to provide, not only in Indiana, but nationally. So regardless of your company's business and product portfolio, the effects of Alzheimer's disease is throughout your business, and it's real. The fact is, Alzheimer's and other dementias are already in your hallways, they're in your workforce, and they're in your paychecks. Ursula gave us some facts. Here's a few others, I think, that really bring this to life. In 2018, 25% of those unpaid caregivers, so family members, were between the ages of 45 and 65. And for most companies, this is typically the most productive group of employees that are disproportionately burdened with this caregiving. Women also are disproportionately bear the brunt of the disease, and they do so in two ways. One, 66% of those living with Alzheimer's disease are women, and more than 60% of Alzheimer's and dementia caregivers are women. The prevalence of Alzheimer's disease and dementia is higher in the African American and Hispanic and Latino communities, which imperils workforce diversity and talent development and growth. And then lastly, employees, I think this is so important for us to recognize. Employees who are also Alzheimer's caregivers are more likely, in fact, almost twice as likely to be underemployed, decline a promotion, reduce their hours, or leave the workforce entirely versus employee caregivers of other conditions and diseases. So not just to other employees, much less, but even to those with other chronic diseases that they're managing. So they need our help. And in fact, I can also speak to this personally because I took a leave of absence when I was caring for my father. I was working at Lilly, and I was fortunate to have a supportive employer and to be able to re-enter into the workforce at the same level that I left, but not everyone is afforded that opportunity. So as local employers, and you all are influencers, we can help by partnering with the Alzheimer's Association. We can ensure best-in-class tools get to those caregivers and families in our organizations that we're not even aware of right now that need this help. And it is the team of the Greater Indianapolis chapter that makes it so easy for you to help. And I can tell you from personal experience that we have not just a great local partner with the Greater Indiana team. I honestly believe that it is known throughout the nation that the Greater Indiana team is the most talented team of all of the Alzheimer's associations. I mean, I absolutely believe that hands down. I likewise believe that it is staffed with some of the most talented people I've ever experienced in profit and non-for-profit organizations. I often joke about wanting to steal them and bring them to my company, but the work they do is so important. I'll let them stay there a little bit longer and then steal them. But they are here to help us and willing to help us. And it's not just that our time, I mean, your time and resources are so valuable. It's not just important that we're giving it to Alzheimer's, but I want you to know that you're giving it to a group that will maximize it and give you a return on your investment unlike any other. So I continue to be moved by the mission. I hope that came across. And I hope you hear something today that moves you too. And I thank you again for being here and for taking the time for listening. And now it is my extreme honor to introduce our next speaker, one of the most talented women that I know, and someone we are so lucky to call our executive director for the Indiana chapter, and that's Natalie Sutton. So Natalie.
Thank you so much, Andi. You really are too kind. Like so many of you on this call, I also have a personal family connection that drove me to begin spending my career with the Alzheimer's Association. I am the little girl in the blue frilly dress in this picture, and this is my grandpa, Don. And he was one of the kindest and probably the most hardworking man I have ever met. He could and he would fix anything, and he would never give up until whatever project he was working on was complete and until he had fixed whatever the problem was. And unfortunately, when he was in his late 70s, my grandpa Don developed vascular dementia, and it was something that no one could fix. So he had a number of other health problems, but it was the dementia that was the hardest for my dad and my grandmother. And so every day in my work, I also think of my grandma Martha, who was his wife of 60 years, who, again, like so many of you, kept him at home and cared for him 24/7 in those last years of his life. Next slide. You can see here that our work at the Alzheimer's Association is about people and science. Science, because ultimately we know and we believe that our vision of a world without Alzheimer's and all other dementia will come about through research. So we're committed to advancing the science, but we're also about people. We know, as the stories shared today make clear, that this disease affects people and families, and we need to be there for those who are walking this journey now. We are a worldwide voluntary health organization committed to this mission that you see on your screen. We live this mission each and every day. Everything that we do is in support of advancing this mission. Ultimately, I want to point out that while our name is the Alzheimer's Association, we do focus on Alzheimer's and all other forms of dementia. And we have from the very beginning when we were founded in 1980. Next slide. One of the things that attracted me to the Alzheimer's Association and that I love most about our organization and the work is that we have a very thoughtful strategy that is comprehensive and attacks Alzheimer's and dementia on so many different fronts. We'll hear a little bit more later today from my colleague, Dr. Christopher Weber, about how the association is advancing science and accelerating research. But as I mentioned, we know that not everyone can wait for those advancements in science and those treatments and cures that we hope will one day soon come. And so we are here to support those through our care and support programs. And we know that when people engage with the association and our care and support programs, their lives are improved. We also work to influence and maximize the care provided by others in our community, healthcare providers, and so many wonderful community institutions offering support. And we advocate and advance public policy for our constituents. Finally, diversity and inclusion is central to everything that we do as an organization. You heard Andi mention the adverse impact on communities of color, and therefore we're very committed to making sure that we are reaching diverse communities with our programs and services. Next slide. The Greater Indiana chapter is one of 75 chapters of the Alzheimer's Association throughout the country. And you see here that we have 19 staff who are serving 73 counties in Indiana. That's a lot of people to serve, a lot of ground to cover, and a few individuals who are committed in a full-time way to doing this every day. What really is the power of the association is our network of volunteers who deliver education programs, who advocate to our legislators, who raise funds for our mission, and who ultimately connect people to our programs and services. We reach about 6,000 people each year with those programs and services. And unfortunately, that's not enough. We make a great impact on those lives that we touch. But you heard Ursal say, 110,000 Hoosiers are living with Alzheimer's and 215,000 people are caring for those. And so the biggest thing that you can do coming out of today's meeting is really share the message of the association and our resources and our free services with those in your networks. Now, the COVID-19 pandemic has been very difficult for all of us, but it has been especially difficult for those living with dementia. Deaths from dementia in Indiana were 14% higher than expected last year. And we saw caregivers struggling at home, and we saw long-term care communities on the front lines of the COVID-19 pandemic. And I'm so proud that during all of this, the association did not miss a beat in continuing our programs and services and continuing to be there for those living with dementia and their caregivers when the need was even higher. Our 24/7 helpline, the phones have been answered around the clock every day since May of 2001. We're there for people at 2 in the morning when maybe the person living with dementia won't go to sleep and the caregiver is at the end of their rope and has nowhere else to turn. We're there during the holidays when people come home to be with their families and they notice changes in their loved ones. And we answer questions big and small. Anything from information about the disease, referrals to local resources, and even very difficult situations that impact safety or may require the advice of a master's level social worker. The helpline is the most common way that people come to our programs and services. And if you share anything with someone who's impacted, that would be the first thing to share. Here in Indiana, our services are also very present in communities throughout the state. Right now, we're delivering all of our services in a virtual capacity, but we offer programs, support groups, and education programs in a variety of settings, publicly to community groups, lunch and learns for employers, and more. And these services are appropriate in the workplace, after hours, online, by phone, in person, whatever you need, we are there to provide it. And we do know that when families and caregivers use these resources that we offer at the association, their quality of life improves. The care and support services, the tools, the resources are all free of charge at all times because of the generosity of our community, individual and corporate donors who engage in our events and make contributions to support this work. And that brings me to my last important point today, which is that, again, everything we do is driven by the generosity of the communities that we serve. Our three largest local drivers of support for the mission are the Walk to End Alzheimer's, The Longest Day, and Chocolate Sunday. You heard Andi mention the event that she'll be hosting for The Longest Day. This is our signature event with the tagline, "The day with the most light is the day we fight." The Longest Day focuses on the summer solstice, but ultimately people design their own ways to raise funds throughout the year to support the association's mission. So Andi and her friends will be playing euchre in June to support the association. Chocolate Sunday is our annual brunch gala and chocolate extravaganza, and we gather supporters locally on a Sunday in November. Of course, last year, we were required to move the Chocolate Sunday to a virtual event for the first and hopefully only time ever, but we had a record-breaking year and raised more than ever to advance the association's mission. And finally, the largest driver of our fundraising support and our awareness in the community is the Walk to End Alzheimer's. Participants in our walk carry flowers that represent their connection to the Alzheimer's Association mission. And we walk for the day when we can carry a white flower to represent a survivor of Alzheimer's disease. And the power of the Walk to End Alzheimer's program is really in our corporate leadership, our volunteer leadership, and the grassroots and individual support from those affected by Alzheimer's and other dementia. At the association, we are very serious about being thoughtful and good stewards financially of our donor dollars, and 78 cents of every dollar that is donated directly funds our mission to advance research and provide care and support. So I know that you're learning today that the need for our services is significant and urgent. And like many nonprofit organizations, our support has been impacted by the pandemic and by our current inability to gather in large groups at events. But we won't stop. We know that Alzheimer's and dementia don't stop, and we need to continue to be there for those who need us. Some of you are already supporters of this work, and I thank you for making it possible for us to continue supporting Hoosiers who need us. For those of you who haven't yet been involved, there is a place for everyone at our table. You can share our resources with employees, with your networks. You can volunteer on our board or in a leadership role for one of our events. There are so many ways to get involved, and ultimately we need your help. So now I'm going to turn it over to my colleague, Dr. Christopher Weber, who's going to provide us with an update on Alzheimer's and dementia research.
Thanks so much, Natalie. Thanks for inviting me to be here. It's great to be chatting with you all this morning. This is wonderful. My name is Christopher Weber. I'm part of the medical science team here at the Alzheimer's Association that's led by our Chief Science Officer, Dr. Maria Carrillo. I joined the association about a year and a half ago as Director of Global Science Initiatives, and I'm involved in projects, events, and initiatives that help advance the science of Alzheimer's disease by bringing together different for-profit companies, academic researchers, and government officials, bringing them to the table all under one roof. And the Alzheimer's Association is in a wonderfully unique position to bring together all these different stakeholders from so many different areas to get them working together in a pre-competitive environment. So my why, I'm a clinical psychologist by training, and early in my career, I found a passion to work in pharmaceutical research and running clinical trials. I've worked on studies for chronic pain, depression, ADHD, schizophrenia, Parkinson's. But over the last 10 years or so, I found myself working mostly with mild cognitive impairment trials and Alzheimer's disease. And about 2 to 3 years ago, as many of you have heard, a lot of these studies were discontinued early because the treatments weren't effective or there were safety concerns. And for me, this was kind of a reckoning, and it influenced my decision to join the Alzheimer's Association, a nonprofit, and looking to see how I can make the biggest impact. So with that, I'm very happy to be virtually with you all in Indiana today to acknowledge what's happening here with the work that is going on in Alzheimer's disease research and give an update, a very high level overview update of Alzheimer's and dementia research and why we're so hopeful for what is happening right now in research. Now, there's so much to talk about, but I'm just going to give you a high level overview of some of the things that are going on and some of the things that are kind of personal to me of what I've been working on. So everything that we do, the care, the support that Natalie was talking about, it's all rooted in the up-to-date research that we're doing in the field. And this approach is what gives the Alzheimer's Association our strength. We have a global scientific community, and it's a relentless focus on helping people and their families every day. So the Alzheimer's Association is the largest private nonprofit funder of Alzheimer's disease and dementia research. And we've supported nearly every major thread of Alzheimer's disease research for more than 30 years. And as you can see from the slide, we have research investments totaling more than $208 million, more than almost 600 active projects in 31 countries. And globally speaking, there's a lot of excitement in Alzheimer's disease research right now. And I think what I wanted to do first, though, was recognize the impact of the research efforts in your community and highlight some really outstanding numbers here in Indiana. So next slide, please. Go one more slide here. There we go. Okay. As Ursal mentioned a little bit earlier, he mentioned a couple of these numbers. There have been 28 grant awards funded in the last 20 plus years. And currently the association is actively funding 9 scientific studies here in Indiana. And this is a $7 million research investment within this community. And overall, you can see that our research volunteers are very active. We've got more than 12,000 scientists across the globe. And locally, there are 55 reviewers that contribute over 700 critiques for our International Research Grants Program. And locally, Indiana has 48 iStart members that continue to connect through resources that the Alzheimer's Association provides for the professional community. And overall, we have a strong funding history at Indiana University and Purdue. So it's all really good, and we're so happy to have this involvement. Next slide. So Alzheimer's disease is a global problem and requires a global response. And this slide is just a sample. It's a visual representation of many of our research programs, our initiatives. We definitely don't have time to go into discussing all of these, but there are a couple that I wanted to highlight for you today. And before I go into that, go to the next slide now. So just a word on how we're doing all of this and how we're moving the science forward, because not only are we advocating and funding, convening, and conducting research, but we're doing it in the context of our research grant program. And when we refer to seed, speed, scale, we seed new ideas, creating and launching studies that maybe other companies or groups can't or won't fund. We speed the development of new techniques and therapies that save time and potentially millions of lives. And we scale the research, making it bigger, better, and faster. All right, next slide. So one of the projects that I'm really excited about that we're helping fund, I work on this project, is the New Ideas Study, which is led by the Alzheimer's Association. And it's helping how to improve the diagnosis of Alzheimer's. Diagnosing a patient with Alzheimer's disease, as many of you know, is very difficult. And we're trying to fix that by finding out what tools or tests are available that can help us identify who has Alzheimer's or who doesn't have Alzheimer's. And maybe their symptoms are caused by something else going on in the brain. And one of these tools is a PET scan. Powerful technology lets us take a picture of the brain that helps us reveal how the tissues and the organs are functioning. And New Ideas is helping us advance the science of detecting an Alzheimer's and understanding how one's diagnosis can improve their overall medical care. And this New Ideas study just began enrolling late last year. And of the 7,000 participants that are expected to enroll, over half of them are going to be from underserved populations identifying as either Black or Hispanic. So what I'm trying to say is New Ideas is a very exciting research project that not only advances the science of detecting and diagnosing Alzheimer's disease, but it's breaking new ground on how this data is collected in a diverse population. Next slide, please. And one other research project that I'm really excited about that we're helping fund is US Pointer, which is a 2-year clinical trial with the goal of analyzing how lifestyle interventions could slow cognitive decline in aging and maybe dementia. And lifestyle interventions, things like healthy behaviors, better nutrition, exercise, things that promote a healthy body and mind. So US Pointer is the first such study in a large, diverse group of Americans and is currently recruiting at multiple sites across the country. And more information about these research programs can be found on our website at alz.org/research. All right, next slide, please. So as I wrap up, I wanted to leave you with a few things that you can do to keep all this momentum in the research community going. A couple of them listed here. So go to your App Store and download the Alzheimer's Association Science Hub app to stay current on the local happenings of the news in research and other developments in Alzheimer's disease. You can go to Trial Match and learn more about clinical trials that you or your family members might be eligible to volunteer for. Advocating for Alzheimer's disease awareness and funding for at your local and national representatives. And as you heard earlier, Natalie was talking about the Walk to End Alz. That's this fall. We've got lots of dates that are set up for this, so please do keep an eye out for that. And okay, my last slide here. So in this brief presentation, my hope is that you walk away knowing a little bit more about Alzheimer's, the Alzheimer's Association's mission and our passion as a global leader in Alzheimer's and dementia science. This is a very exciting time in research today. There are so many new tools and technologies being developed to detect and diagnose the disease as early as possible. And overall, we're better understanding the brain. There's more diversity in the approaches to how we're treating the disease than ever before. And I truly believe that new research is leading to a future of therapy that combines drugs and modifiable risk factor interventions. And I think we're all very much moving in the right direction with all of your help and assistance too. So just know that there is hope in research, and it will be the way. It's the way that we're going to discover how to stop, slow, and prevent this disease. All right, thank you all for attending, and please continue to be involved locally. And with that, I'm going to introduce John Loftin, the chair of the Indianapolis Walk to End Alzheimer's. John.
Thank you, Dr. Weber. Thank you for all the work that you're doing along with the Alzheimer's Association. Certainly love to hear the words hope come out when it comes to a potential cure down the road. Thank you for all of you for spending some time with us this morning. I know another Zoom meeting in this Zoom zombie state is not what was on the top of your list. So it's not lost on us that you're choosing to spend your time with us, and we sincerely appreciate it. As Dr. Weber said, I'm John Loftin. I'm the President and Chief Operating Officer at MJ Insurance, headquartered here in Carmel. And I'm also extraordinarily honored to be the chair of the 2021 Walk to End Alzheimer's. And, you know, I was thinking about it. It was about this time last year that I actually sat in your seat, and I was invited to this event, again, virtually, listening to Mark Miles and Tony George and Mayor Hogsett and many others tell their stories that were so incredibly heartfelt and impactful, as well as sharing of some of the information that you're hearing today. And I attended that event at the recommendation of a friend of mine who knew my why. And as the slide indicates, my why is really based on many things, but three primary reasons why I participate in the association and continue to do so today. My mom and my dad, I lost both of them to dementias. I lost my dad in 2008 at the age of 66 to frontal temporal dementia. He had some other underlying health issues, but certainly the frontal temporal dementia was the one that was ultimately took his life and was the most complicated for us. And then subsequently in 2017, I lost my mom to Lewy body dementia. We grew up, my sister and I, as my only sibling, we grew up in Princeton, Indiana. I like to tease Natalie. She grew up in Hopstock, which is a suburb of Princeton, of 8,000 people suburb of Princeton. But that's where my mother and father lived. They were divorced, but that's where they lived when they got sick and when they ultimately passed away. Another huge reason is my sister, also pictured here, is a caregiver. She lives in Princeton today, lived there at the time. I've lived in Fishers for 27 years. And the proximity to my folks and the need for their care thrust my sister onto the front lines, and she was had the lion's share of that responsibility. I certainly did what I could, but from a 3-hour drive away, I couldn't attend to those urgent situations that those of you that have gone through caring for parents or loved ones know that there's, you're a phone call away from having to deal with some really very difficult things. And Ursal, I certainly empathize with you trying to deal with this from around the globe, and our thoughts and prayers are with you and your family as you try to navigate that extraordinarily complex issue. I talk about my sister probably more than I talk about my mom and my dad. While I miss both of them dearly, and that was really an emotional, very emotionally difficult time for us, watching them just wither away cognitively, where they are both such sharp people. My sister, again, being the caregiver, again, would be there daily. My parents were divorced. My dad lived alone, so he lived with her for a period of time. And as you can see, he wasn't a small guy, and she had a tough time with him in terms of falling and just the physical demands on that, until we had to ultimately admit him into long-term facilities where he ultimately passed in a nursing facility. My mom was more fortunate. She did remarry, and she was able to live out her remaining days in her home, which was fantastic, with my stepfather, but still unable to care to the extent my sister could and should and did. So my mom passed on December 28th, 2017 at about 10 o'clock in the morning. And throughout the duration of that day my sister and I were there together. My family was able to get in town, my kids and my sister's kids, having just the normal conversations that you had, reflecting back on my mom's life. And throughout that day and into the next morning, as we started to plan my mom's funeral, I could see this sense of relief set in for my sister. And it wasn't a disrespectful relief, that mom's gone, I'm good, it's great. No, it's not. It was extraordinarily a grief-stricken time. But this relief of she and her husband spent the vast majority of, I would say, probably 5 years in caring for both my mother and my father. And her kids were grown in a way and live out of state. I could see the sense of her and her husband starting to visualize a new normal, starting to visualize this life of empty nesters that they were looking forward to. And the twist for us, just a sudden and very tragic twist for us, is the very next night after my mom's passing, my sister's husband, my brother-in-law, passed tragically in his sleep of a brain aneurysm. So my sister lost her mother and her husband in less than 40 hours. And there I sit and watch the grief on her face, feeling, almost a sense of guilt that I couldn't have been more helpful during the time that she cared for my parents. But as a result of that, just another sense of motivation for me personally, that I work with and for and advocate on behalf of the Alzheimer's Association as much, if not more, if this sounds a little bit crazy, for caregivers, for the reasons that I've explained. I think Andy did a fantastic job of articulating the lack of awareness that she had. We felt the exact same way. We felt that, man, only if we had known about the Alzheimer's Association. And we went through it twice. Nobody told us about it. The physicians that we were with didn't tell us about it, didn't refer us to it. So we walk and work on this mission to bring awareness to that on behalf of caregivers. To the extent there's not a cure in my lifetime, I hope there is, but we certainly are on a mission to try to help those families, because I believe Alzheimer's and other dementias are diagnoses of the entire family, not just the patient, because of the care that's required to be given. So we hope that we can do whatever we can to bring awareness such that the resources of the Alzheimer's Association continue to develop and help those families that are enduring this just extraordinarily complex and emotionally impactful journey through Alzheimer's and dementia. I also believe that from walking away from that meeting last year, I was equally as compelled as an employer, as a business leader, that I would go so far as to say we have an obligation as business leaders to bring our associates and clients in the communities that we work and live, to make them aware of how incredibly difficult and the sacrifices that our associates and employees make when they're dealing with Alzheimer's and dementia patients. Not only that, I will go so far as to any elder care or any care for a sick child that's critically sick, that I have a newfound appreciation for what that means as an employee of an organization. I, like Andy, was very fortunate that I had the flexibility to do some things that I needed to do, albeit I couldn't step completely away. And as a result of that, I'm very empathetic to any of our employees that are enduring anything that would require them to be away from their job to care for loved ones, regardless of the diagnosis, but especially from Alzheimer's and other dementias. You think about it from that perspective, your business will thrive in the sense that there's absenteeism, there's turnover. Andy did a great job of articulating that data that suggests that people are underemployed or unemployed as a result of having to step away. I think we've got an opportunity to make sure that that's not the case, that we can accommodate some of those things. It's not easy, but I think it's certainly a better result than just letting folks walk away. Not only that, but just think about the economic impact that this disease has. Some statistics would suggest that over 350 billion with a B in the United States alone goes to care for Alzheimer's and other dementias. Unfortunately, that trajectory to 2050 is on an exponential rise to over $1 trillion just in the US alone. And this statistic is the one that really put it in context for me. If you think about the amount that we contribute to Medicare, for every $5 that we contribute to Medicare, $1 of that goes to simply fund the care for Alzheimer's. So it's without question the economic impact that it has on us as employers, not just from the dollars and cents of it, but the loss of productivity, turnover, absenteeism, and everything else that goes along with this disease. makes it a really easy argument for me to make as to why we as business leaders should all be cognizant of and get involved with the Alzheimer's Association. So as I walked away from this event last year, hearing it for the first time, all the resources that the Alzheimer's Association has and the mission that it's on, for me as a business leader, I was a little reluctant to get involved. A unique ability of mine is not philanthropic fundraising. The passion that I had for it propelled me to do that a bit, but I know as business leaders how often we get approached to participate and support very worthy causes on the philanthropic spectrum, and we all want to do as much as we can. Yet we all have our personal connections to this that compel us to do so one way or another. So a little hesitant and admittedly procrastinated, but became a team captain for the walk. And probably at Julie and Natalie's nudging, John, how's it going? How's it going? I see you set up your team. I finally put together an email that told my story a little bit about how I told it today. Sent out one email to about 35 of my closest friends and colleagues and business partners. And I was completely overwhelmed, emotionally overwhelmed, quite frankly, at the response. One email generated almost $13,000 in fundraising from one email. And then not just that, it's not just $13,000, but what that told me. I got so many phone calls and so many responses about, I had no idea that you experienced that. I lost my dad or my mom, or I'm dealing with this now with my grandmother, or whatever the case may be. It helped me understand the breadth and depth and the impact that this awful disease has on just about everybody. Statistically speaking, you're going to experience it. That's how I like to state it. That may not be backed up by data, but you're going to experience it on a probability basis. So that's what has compelled me to continue to get involved. And when Natalie called and asked me to chair this event, I once again said, you know, I'm not a very good philanthropic fundraiser, but I'll absolutely do this. And it's out of core passion for doing it. So funding is obviously necessary for the Alzheimer's Association. But as I mentioned before, what's equally as important is awareness. And that's what the Walk to End Alzheimer's really does. It certainly raised funds, as Natalie mentioned, but the number of heads that we get to participate in this grows exponentially. The awareness grows. And that's really what's going to tip the scales once this becomes widely understood of how you can individually impact this. Just making it more aware is success in its own right. And I know we as business leaders have the ability to do that. So I spewed a lot at you quickly, and brevity is an issue of mine. So I'm quite proud of myself for getting that all in just a few minutes that I did. You're welcome, Natalie. But I hope, again, my sincere hope is that you join us in this effort in any small way. I know 75% of you are personally impacted, 25% of you aren't. But I hope in some small way that you walk away from this meeting, as I did last year, compelled to at least learn more. And I stand ready to help in any way that I can. And thank you very much. So I'll turn it back over to Ursal to close us out today. And thank you again for your time.
Thank you, John. Thank you all for taking time this morning to join us. Obviously, I want my call to action today is to commit 30 minutes with Indiana Alzheimer's team. Consider the impact on your family, friends, company, workforce. Think about how you can share resources and support the mission. Through the pandemic, the Alzheimer's Association Indiana chapter continues to serve and support Hoosier families impacted by Alzheimer's, many of whom are and your employees and our clients. Please find your fit, whether personally, professionally, or both. This disease is complex and expensive, with impact far beyond today's specific challenges. We have great researchers locally and nationally. I truly believe they will find the cure for disease in our lifetime. We have a great part to play in fighting this disease, and I urge you to find yours. Thank you again, and have a fantastic week. And great to see some of you.